Hey, what's up, everybody? You've tuned in ThinkNDN 100.5 FM CFRO. This is your host this evening, Suzette Amaya, and I'm with John Sue from Indigenous Innovations. John, how are you doing today?
I'm doing awesome. It's a Monday and the weather's amazing. How are
Well,
you?
I'm good. We've had a lovely summer, and it's kicking in right now, and it's so wonderful that you reached out to our show. Tell us about Indigenous Innovations.
So our company, Indigenous Innovations, is a First Nations wellness clinic. And what we do is we help First Nations navigate the healthcare system. So we help a lot of clients do the paperwork, call doctors, chase down prescriptions, anything that the client needs, in terms of assistance, that's what we do. And the big difference between us and a lot of other organizations is we've really brought the humanity back to helping people. If you look at a lot of these associations, doctors, and everybody else, how they treat First Nations or people in general is their intention is to help people, but how they operate is they want to avoid all liability first and then help you second. So when you look at a lot of how we do things, it's very personable. It's very people to people. We do what makes sense as opposed to, trying to avoid getting in trouble. Because when you're helping people, how can you do that wrong? Right? The only time you can actually do that wrong is if you're trying to offer someone help who doesn't want it. Right? But otherwise, you cannot help somebody the wrong way.
So tell us, like, what kind of service would you say for an Indigenous person who wants to access your resources? What are the typical kinds of cases where a person contacts you and is looking for assistance?
So the most general case is somebody who's wondering, what are my status benefits? How do I get things? Um, if a doctor's not providing you proper service, or if you have medication that's not covered by status, but you need it just to have a decent quality of life. Uh, it's basically anything to do with the medical system. That's what we can help with on a very general level, though. So the four things that we cover are feet, teeth, eyes, and medicine. Our office is located at 122 East Hastings, right downtown, centrally located. In Vancouver, our team, our resident elder is Kelly White from the Musqueam Band. And we also have another teammate, January Tom from the Navajo Band. And then there's myself. And something that we've just done is we've just opened up a non-for-profit First Nations Outreach Wellness Society. So that's something that's going to be creating a community presence in the downtown east side. And probably around January, February of next year, we're going to actually expand it out into Surrey. But we're going to have people walking the neighborhood, creating a presence so that if you're First Nations and you see these t-shirts, First Nations Outreach with this eagle on the back, this means we are here to help you. And if you have any questions on your First Nations, you can just come up and ask us. One big thing that we really focus on doing is making our services accessible. So instead of thinking, oh yeah, we provide a great service, you should come to us. Absolutely not. What we'll do is we'll actually get people to walk the street and bring the service right to you, where literally you could be sitting there and you see the red t-shirts and you just say, hi, I'm First Nations, I have questions. And that's the whole thing is, no matter how great service you provide, if it's not user friendly or easy to use, no one's going to use it. So we thought about it, breaking down every single barrier, physical, mental, social, to say, we're here to help. All you got to do is just say hi.
That's so wonderful. Because, during the pandemic, it was a tough time where things started to surface, where Indigenous people were experiencing racism and prejudice in the healthcare system in regards to the emergency, uh, at the hospitals, where it came to light that people were betting on alcohol levels of Indigenous people who came into the you know into contact in the emergency centers, and over history there was sort of some research done why Indigenous people sometimes are hesitant by accessing the healthcare system when they're in need or in crisis. And so something like this is exciting because it's open, it's safe. Did you see an increase of people who are accessing your services?
To be honest, this is so new that that nobody has even heard of what we do. So pretty much everything's an increase. You know, when you start on ground zero, there's only one direction you can go, right? So we've been going up. The big thing a lot of people have been saying is they wish that they knew about us way earlier, because what we do for people is exactly what our clients need. And as the whole thing is just kind of what you said, there's very little trust in the medical system from Indigenous people. If anything, there's distrust. And, you know, my partner, Adrian Beaverbone from Edmonton, uh, he let me know that, you know, Indigenous people don't trust the medical system. But until I actually got to hear about the stories and challenges of the clients, I didn't know how bad it was. So here's a good example of how much distrust there is, especially among the elders who have been through residential school. There's a belief amongst the elders that, and also Indigenous families and Indigenous clients, is that if you go to the hospital, you go there to die, not to get help. And then it just blew my mind the first time I heard it. And then I started hearing it more and more amongst our elder clients. And I was thinking, how is that possible? When I go to the hospital, I'm going there to get help. I don't go there to die. But when I realized and heard the stories of my clients and how much distrust they have in the system, and also that the fact that they're so afraid of going to the hospital because they think they're going to die, that they actually avoid it at all costs, which also means if you need medical care, you let the disease build up and you get sicker and sicker and sicker until you're at home, where basically your family members calling the ambulance because you passed out. Ambulance, because your health has deteriorated so far, ambulance comes when it's too late. And then you look at the whole story of, okay, now I see how people can see that when you go to the hospital, you don't come back. So we thought about it. That trust issue is so big that how do you rebuild trust? And the only way to rebuild trust is with actions, not lip service, not big promises. It's like, don't believe me. Hey, man, I'm an Asian guy. You know, a lot of people are like, you're Asian. Why are you helping us? Because I care, because I'm a human being. And one thing I wanted to be clear about is we are actually a business. We're not a government agency. So we do make money, we do profit, and we're not affiliated with a First Nation Health Authority or anything. We're just a business, caring citizens, looking to make a difference to help First Nations. So understanding both sides of things, we understood that we had to rebuild trust before doing anything. And how I started in Vancouver is I went to that downtown East Side market and I just stood there week after week after week, smiling, remembering people's names, and just building that relationship, because it all starts with, who's that guy? You know, is he a cop? Then, hey, I've seen him here week after week after week. Then eventually they'll come and say, hey, what do you do, man? You a cop? And I was like, no, man, I'm not a cop. I'm too small to be a cop. And then I would just tell them, we help First Nations with healthcare. And that's kind of how it started. 2 years ago, I started in the downtown East Side market, was there every weekend, just building relationships. And then we got our office, you know, at the Brandies there. And then people that I've talked to months ago finally started to come in. And as we've been there 2 years now, we probably helped around 500-600 people. Then we get the reputation and then the referral. And then now we have a decent reputation that we're trustable. And now kind of the reason I'm reaching out to everybody else is now we need to turn it up to let everyone in Vancouver and Lower Mainland know that there is an association that actually is there to specifically help First Nations, and they actually get stuff done. Right. And I think that's kind of the big thing is, it's funny where I'll have some clients actually call me and they'll say, hey, I got these symptoms. What do you think? And I thought, I'm not a doctor. Why are you calling me to ask me that? You should call your doctor. But I was curious. I'm like, why would they call me to ask me that? And they said, the reason that we call you, John, is that we know you will help us. You know what I mean? And when you hear stuff like that, I used to be a realtor. Clients say, oh, thanks for helping us with the home transactions. Thank you. Thank you. You know what? No problem. But when somebody, when a client says something like that, especially knowing their history of where they're coming from, it's a significant thing.
John, I can see that you have such a big heart and, sincere care for the community. And it's so important because of that, building that trust and helping people navigate through the healthcare system. What does it look like for someone who accesses your service when they walk through the doors?
Yeah, they would just come in, fill out an application form. We'd find out, the four things that we can help them with, give them all the information, make the contacts for them. And literally all the client has to do is show up for their appointment. If there's any problems, they call us. So like one big thing that we notice in the medical system is there's very little accountability for people who screw over our First Nation clients. So one thing I hear a lot of is maybe the client, had a bad day or did something that the person didn't like. Then they basically got kicked out of the store and pretty much, I'm not helping you. And I just thought that's not cool. One, you're supposed to do your job as a professional. Two, when you're working in that community, you have to have an extra layer of compassion, right? Like one thing that I did, because the only First Nations person I knew before getting into this industry was my partner, but I never knew how deep the issue was. And because I actually took the time to find out where the history of is, residential school, the Indian Act, the blanket ceremony, and I'm not talking like I have a PhD in it, but I just took an hour to do some Google research. I was like, whoa, this is some deep stuff. And therefore, now that I know where they're coming from, it gives me that human capacity to have that extra layer of empathy that I don't have for other people. Because not everyone most people don't come from intergenerational trauma, right? It's not like your regular trauma. Oh, I gotta go see a psychologist. This stuff runs generations deep where it's almost like a truth, right? And yeah, when I understood the complexity of that, that gave me the empathy, the care, and even ramped up my commitment to make a difference. Because what I realize is I'm not doing anything special. I'm just when you think about what we do, we're high end customer service. We're Holt Renfrew, but in the downtown east side.
I love that. And there are barriers and there has been prejudices within the healthcare system. And there's I even on Facebook you see the like, hey, does anyone know where I can get glasses that'll take status, or where what dentist is going to be great, where I'm going to be treated with care and respect and get those services. So when somebody says it on Facebook, where do I go to get glasses? Um, is it best to say, hey, go check out Indigenous Innovations?
100%. All you gotta do is call us, and we can suggest where you want to go. All the people that we work with are people that I know personally. So I know all of these small businesses. I know the owners, and that's what creates that extra level of accountability. So for example, if I send somebody to your business and they're like, "Yo, Suzette, wasn't doing very good," I can pick up the phone. Hey, Suzette, there was a complaint. I'm not going to take sides right now. Here's what the client said. What went on? And then you're going to share your story. And if there is an issue, where you didn't serve this kind, I'd be like, hey, Suzette, that's not cool what you did, right? And that's kind of what we do is we function as an advocate for the client to make sure no one's screwing around, right? And that's the thing is our clients don't complain to the service provider, they complain to us, and then we follow up with them on it. Because I think that's the key thing. We notice a lot of how does racism still exist in today's medical system? It On the one side, I realized it exists because there's not enough complaints formally filed. You know what I mean? So all of these doctors who are just a few, most of the medical system's pretty solid. They're good people, good Canadians who want to help other people. But there's a few bad apples who have been around forever that really need to retire. And they're the ones that are pretty much the racist ones, the ones creating the bad images for everybody else. Um, those people, we told our clients, if anyone ever does that to you, come in, and it's not my job, but let's file a formal complaint because I know how to do it. I'm going to follow up, and we're going to make sure somebody is held accountable, not your typical, oh, we don't endorse this, we're going to investigate. And then what the hell actually happened? All this investigation and wash your stuff down. Like if you look at it, all the police brutality, all of the abuses of power, they always talk like they're going to investigate, but what actually happens? You know what I mean? Besides the lip service of we're going to investigate and then slap on the wrist and go and do more bad stuff that that got filed up against you in the first place.
I love that you're bringing accountability and providing a safe space for people to access service, because for so many years, Indigenous people don't reach out and are under service due to situations like you're just speaking of. And you know, and I do love that when I go to your Facebook page, there's opportunities to volunteer or be a part of this movement. And you know, I mean, I've seen young people or people in our community also get perks from you guys, as far as, you know, I've seen in the past where there was like an iPad or something, or you know, ways to encourage people to spread the word of this new movement. And I think it is like a movement because you're doing something that's unique and different and very, very much needed.
Yeah, probably the biggest thing that is different from what we're doing is you see a lot of stuff where it's the government helping, First Nations or Indigenous. What we're doing here at Indigenous Innovations, this is just people coming together, Canadian with First Nations working together to create that system. Because if you look at what we were doing, it's like a mini medical system. We don't own any hospitals, stuff like that. But when you go to a pharmacy, it's a small business. You go get glasses, it's a small business. You go to the dentist, it's a community or small business. You go get dentures, small business. So why not us as Canadians come together as a true partnership and collaboration and work together to support the people of this country? Because now with everything happening with residential school, cat's out of the bag. Government distrust is at an all-time high. Canadian support of Indigenous people is at an all-time high. If you can see, you can't turn a blind eye now, even if you don't got Facebook. You cannot turn a blind eye to what's happening to the children. You cannot turn a blind eye to what has happened to Indigenous people. Because myself, I've been in Canada for 40 something years. I only learned that there was an Indigenous Day 2 years ago. I only learned about residential school two years ago. All of this stuff 2 years ago. And a lot of Canadians are kind of the same way. Like, what the hell is going on? And then you start to see the cat come out of the bag, and it just makes you think. Now I understand how come the situation with Indigenous people is the way it is. Because
Mhm.
if you don't understand, you're like, oh yeah, they made their bed, they got to lay in it, right? And maybe one generation, I make sometimes you have one problem, one generation, no problem. But trauma and intergenerational trauma is very different. Total different cat in the bag. And yeah, people would say, no, it's trauma is trauma. No, absolutely not. That's like saying first degree in manslaughter. There's a reason you get 6 years versus a lifetime. I'll take 6 years any day.
Yeah. Thank you so much for sharing. You know, I can tell you come with a lot of wisdom and understanding. And it's people like yourself who are, you know, being allies to Indigenous people and helping our people when there's been so much distrust and atrocities through government organizations and institutions. And healthcare is one of them for sure. And so I commend you. And I'm really excited about this to be able to share this with our community on our platform. And again, how can people access or have inquiries? What are the contact informations again?
Yeah, so you can call my cell number direct. It's 778-806-6993. We have a Facebook page, Indigenous Innovations YVR, or you can email us at indigenousinov@gmail.com. And come on down, come say hi, come listen to what we offer. And I think you'll see that how we do things is really Indigenous focused. It's Indigenous friendly. How we build things and how we run things, it's based on what our customers have been telling us about what their problems are, what's not working for them in the current medical system. Um, and that's kind of one significant difference between us and the regular medical system. The regular medical system is built by non-Indigenous for non-Indigenous, and they wonder how come it doesn't work, right? Where for us, we had a way of doing it, didn't work, so we asked, what might we do differently to help the client? Because at the end of the day, it's about helping the client, not doing what's easy for us. If it was easy, if we were to do what was easy for us, then we would be no different than the medical system today, which does not work 100%. And I don't have the report or any $1 million government report to prove that, but I can walk the streets of downtown East Side and ask them, hey, how's that medical system working for you? And I bet money they're gonna say not really well. And it's just like a small adjustment of saying, well, what's something that we might do? And that's kind of what we've done is we pound the pavement, we talk to our clients, and we make adjustments to help them. And it's always the middle ground of what works for the service provider and also the client. Because that's always the solution, right? It's like a relationship. Is the wife always right? That's what we want to believe. But the solution for the relationship is, hey, let's work on something that works for both of us, which is a hybrid of both of our wants and desires. And then let's be fair, because that's what happens in the real world. Solutions that work for both sides, because two people got to do it. And when you try to do those one-sided solutions, they never come to life unless you're the government, who kind of doesn't does whatever they want, and they do it for more, in my opinion, marketing than actual results. Because if you look at government results, they get a failing mark from me.
100%. And when I think of all you're accomplishing right now, I love that you are helping people who are the most vulnerable, because they have our community members in the downtown east side have definitely, people do put a blind eye, or there's a ton of mistreatment. And so it's so wonderful that you're committed to helping folks down there, but also now being more aware to share this knowledge with the rest of the community in the lower mainland. So thank you so much, John. And again, reiterating from the start of this interview, what are the services again? And so that we can kind of put it in a nutshell, so we can encourage our folks to come in and access your resource.
Yeah, so we help with feet, teeth, eyes, and medicine. So stuff like custom orthotics, knee braces, arm braces, back braces, dentures, need a new dentist, need a new doctor. Or if you're being mistreated in the medical system, or there's something that you can't figure out and your doctors can't figure out, give us a call. Because I guess this is one thing that we have that benefit that is probably our unique service, is that we can talk to healthcare professionals off the record. So for example, medical people, they have to do everything by the books or else they're going to get in crap or get sued. But sometimes in real life, by the book is just not practical. So I'll share a good example with you. There was a client who just had a heart attack, got a stent put in his heart. He didn't have the money for the medication, and he needs a specific medication for a blood thinner. If he didn't have it, he was actually going to die. The cost of the medication was $30. So $30, I'm talking to somebody where his life could end over $30. And I just thought about it. Wow, that's freaking harsh. And that's like a daily reality of what we deal with. People's lives teeter-totter on very little money, but we hear it so often. But he didn't have the money for it. And then I just talked to our pharmacist and I said, off the record, what's a real solution? And the pharmacist says, he got two solutions off the record. One, he finds the $30 to save his life. Or two, he just calls 911, fakes a heart attack, and he'll get the medication paid for by the government. And you have no idea where the client, I'm talking to the client on the other line. He's like, John, what the hell should I do? Sit here and wait for a heart attack? And I thought, my God, you're going to give yourself a heart attack sitting there thinking about it. And I just told him, let me make some phone calls. And because I'm not a professional, I'm just a business person, a citizen. And because it's off the record, he gave me a real world solution that could have saved someone's life. Sure, is that abusing the system? Yes, it is, absolutely. But it's to save a person's life. Because otherwise, we're going to follow the system and let people die, right? So that's the kind of solutions we can provide for the client. Is we do things that I guess bend the rules, but it helps the person in the end. And that's the most important. Is we're not like breaking the rules, doing fraudulent stuff. It's we're utilizing the system so that we can actually help our clients and getting real world, like inside information that's really helpful. Because the world, life is not about by the books. That's that's the worst thing. You know what I mean?
Well, and then think about it too, is that we live in one of the most expensive places in in the world. And and we're talking about a community of indigenous people who are vulnerable, and we've had distrust in the system. And there's so many barriers for indigenous people in life. And so this definitely helps meet us where we're at and access resources, and breaking through those barriers within a system that was created, you're right, for non-indigenous people.
Yeah, and that's the thing, is you hit it right on the nail. Is we meet our clients where they are at.
I
That's
love
how you
that.
build trust. That's how you build relationship. It's not okay, come here. It's, hey, I understand where you're at. We need to go over there. Here's what we need to do together, right? Do you want to do this? Because one big thing is we are not a handout organization. We are a hand up. Most of our clients, they want to get healthy. They want to use our services. And we're just that option to say, if you want to do this, we can help you. But here's what you need to do. Because at the end of the day, it's about you taking authority over your own life. And we're just the company to, connect the dots of how do you make that happen? Because you can go over there, we can help you. We can help you get healthy. This is the stuff you can use, but you got to do it, right? Because there's a point where because we're a for-profit business, you can't help somebody who doesn't want your help. And a big thing for us is we just say people, hey, if I'm annoying you because I'm calling too much, let me know. Because some people say, you know what, John, I'm not worried about that right now. Got other problems? Okay, no problem. I'm gonna not stop calling you because we do a lot of follow-up. We call you like that crazy ex-girlfriend.
Well, and crazy ex-partner. I love that. But yes, thank you so much, and I think it's important because that little extra bit of care sure helps someone feel not alone in a world where there's a lot of people who are alone and struggling with um, you know, illnesses and all types of different things. Again, you will be having people walk around the downtown east side and around Vancouver in these wonderful red shirts.
Yep.
And I'll be able to share it on our Facebook page as well. But before we go, I want to thank you so much, John, for your time and sharing with the community about your business and how you're helping Indigenous folks. And again, the contact information.
Yeah, my phone number direct is 778-806-6993. And my email is indigenousinov@gmail.com.
Wonderful. Thank you so much. And is there anything you'd like to say again to the community?
Yeah, I would like to say, even if you don't need our help, check us out. We can do a lot of awesome things. We can make things so easy for you. And it's not a matter of need, it's the smart choice. Why would you work harder when you don't need to? Why don't you have somebody take care of you and just say, here's what I need? And then somebody does all the work for you and make sure and send you to a place where you're going to get quality service. Why wouldn't anybody want that? You know what I mean? It's like, if you could do it smarter, why not? Right? Because we definitely make it easier. We definitely make it simpler. We just need to know people to know that we're out there and we're here to help, specifically First Nations.
Wonderful. Thank you so much. And again, that's Indigenous Innovations. Thank you, John. And we will definitely be sharing this information with our community members so they can help navigate themselves and, also receive advocacy and access the resources within the healthcare system that they need. And that is important.
Thanks so much. I really appreciate you doing the interview and sharing on your webpage. Yeah, thank you very much.